Chapter-6. Garrett. A few days later. Good morning, Dr. Young. Ready for another day? Renee smiled at him from behind the desk.
I am. He glanced around. Where's Yolanda?
Break. I'm covering for her until she gets back.
Oh, I see.
He grabbed a chart and scanned it. Sore throat with a mild fever. That could wait. He grabbed the next chart.
Man, did you miss a crazy case last night? Just as I was about to get off, the ER had a kid come in who'd collided with another kid at school. They were worried about a concussion, so they called me. Turns out the poor kid not only had a concussion, but fractured his orbital bone.
Renee gasped and covered her mouth. Oh, no. That's awful. How old?
13, so you know, tricky age.
Renee nodded. I sure hope the other kid's okay. Did he or she come in too? Garrett shook his head.
Not that I know of, but I hope so too. It's hard to believe a hit that hard wouldn't have affected the other kid in any way.
Renee glanced around the nurse's station as if worried someone might overhear. Well, I'll be praying for both of them, and I'm very glad they had you to call. Garrett tilted his head to study her.
You're a believer.
I am. It's not forbidden to talk about here or anything, but some people get weird when you mention praying for them, so I try to keep it quiet. Her eyes grew wide as if she just realized what she did. I don't know why I even said that to you, not knowing if it would bother you or not. I'm sorry if it did.
It didn't. I'm a believer too.
He flashed a genuine smile at her.
It's nice to know there are others. My last hospital wasn't super friendly toward those who practiced their faith.
Renee nodded. Yeah, I've been in places like that. I hate hiding it because we're all called to share our faith, you know? But sometimes it's easier to keep your head down and be helpful than put a giant target on your back.
I get that. So will there be a get-together this week?
He still wasn't sure if he wanted to ask Renee out, but he had definitely missed her yesterday when she'd been off, and they'd been so busy the days before that he hadn't gotten much opportunity to talk with her. Even if it didn't turn into a relationship, he wouldn't mind getting to know her better, and he could definitely use friends. Renee shrugged. I hope so. But because Riley and Neil work in the ER, their schedule is more erratic than mine, so I let them schedule.
Oh, I guess that makes sense.
What didn't make sense was why he felt dismayed by that information. But I could meet tonight after work if you'd like. It wouldn't be a group, though I do have some other friends I could invite. Or maybe you'd like to get a coffee and take a tour of the town? I doubt you've had time to see much of it yet. Garrett hesitated for a minute. He definitely hadn't had time to tour the city, and he did want to spend time with Renee outside of work, especially now that he knew she was a believer. But would she think it was a date? He wasn't sure he was ready to date her yet, but would a coffee and tour really count as a date?
Sure. I never say no to a good coffee, and I could use a tour of the city. I pretty much only know what's within a block of the hospital and a block of my house.
Oh, well then you definitely need to know what else the city has to offer. Let's shoot for 7?
7 sounds good, as long as no emergencies come in.
Of course. She picked up a chart and handed it to him. Take the stitches. It will be an easy way to start the day.
Stitches? Okay, well, that seems simple enough.
It should be, but page me if you need any help. She flashed him a smile before turning her attention back to another chart.
Okay, will do.
He tapped the chart lightly and then headed to the room to deal with the stitches. A woman who appeared about 40 looked up from her phone as he entered. The girl sat on the table staring at her finger with a look of intense fear.
Hello, I'm Dr. Young. I hear you get your stitches removed today.
The girl glanced up at him with wide, fear-filled eyes. "Will it hurt?"
"It shouldn't," Garrett said. "Generally, patients tell me that removing the stitches feels like a little tickle."
"You mean you don't know?" she asked. Her face folded into an expression of terror, and she pulled her hand closer to her chest.
"Well, I've never had stitches myself, but I trust what they say. Can I take a look?"
He'd looked over her chart before he entered. The girl had cut her finger on the metal lid of a cat food can, and it had sliced her index finger pretty deeply. The stitches had only been in for a week, but as he looked at them, he could tell they didn't look quite right. He turned to the mother.
"Is she a fast healer?"
The woman rolled her eyes. "Abnormally so. We tried to get her ears pierced once. We forgot to turn the studs one day, and her skin started growing around the posts. After taking them out, they completely healed over 2 days later. Why? Is something wrong?" She stood up and came to Garrett's side as if trying to see what he did.
"Maybe not, but I'm afraid her skin might have grown over her stitches."
He could still see the middle of the stitches, but it was thinner than normal.
"It's possible they just used a smaller technique, though."
"Does that mean it's going to hurt?" the girl asked, her voice quivering.
"I hope not, but we'll see. You let me know if it does, okay?"
She nodded, but he could see the tears forming in her eyes already. Grabbing the small scissors, he made the initial cut and then switched to the tweezers to pull out the string. It did not come easily, and the girl yelped when he tugged on them. "Ouch! That does not tickle," she said.
"I'm so sorry."
He studied her finger for a minute. There didn't seem to be a way to get them out without causing her pain, but maybe he could limit it.
"Well, I have a couple of options. I could give you a numbing shot to decrease the pain, or I can just pull quickly, like ripping off a Band-Aid."
The girl's teary eyes pulled at his heart. "Which will hurt more?"
"I don't honestly know. The shot will have a little pinch like most shots, and just pulling the threads might be quicker, but it might hurt more at the beginning."
The girl pressed her lips together and looked over at her mother. "I think you should just let him pull the stitches," she said. "Okay, just be quick." The girl took a shaky breath and pulled her shoulders back, trying to be brave.
"I'll do my best."
Though he wouldn't feel the physical pain, Garrett braced himself as he gripped the next string with his tweezers. He didn't want to miss and cause her unnecessary pain. He pulled the first one, wincing a little as the girl yelped, but he barely paused as he moved to the next one and tugged it out. A second later, they were all out. The girl's finger was pink, but she had only yelped once more.
"Okay, all done."
"You're finished?" she asked, her voice hitching slightly.
"Yep. You were very brave, but I am sorry that it hurt more than it should have."
She stared at her finger and shook her head. "I'm never going to do anything to need stitches again."
"That sounds like a good idea."
He smiled at the girl and then looked up to her mother.
"I'll send the nurse in with your paperwork, and then you'll be free to go."
"Thank you." Garrett dropped off that chart at the station and grabbed the next one. Possible dislocated shoulder. It was shaping up to be a pain-filled day for his patients. At least this one was older. Ryan Ziegler was a teenaged boy. Although as tall as he was, he wouldn't be considered a pediatric patient for much longer.
"Hey, Ryan, I hear you dislocated your shoulder. Want to tell me what happened?"
The boy shook his head. "Man, it was so dumb. I was playing basketball, and I went up for the layup, and this dude shoved me. I landed hard on my shoulder, and pop, I felt it." "I told you playing basketball was dangerous." Garrett hadn't noticed the woman when he entered the room, but he turned his attention to her now. She sat in the chair farthest across the room, a slight scowl on her face and her eyes glued to her phone. He assumed she was the mother, though she was much shorter than the boy, and she didn't seem too concerned about his pain. Ryan rolled his eyes. "You say every sport is dangerous, Ma. If I listened to you, I'd never play anything."
"You'd also be in less pain," she said, barely looking up from her phone. Garrett tried not to judge. He didn't know her story. Maybe she'd had a long day and was just decompressing. Or maybe Ryan had been injured a lot and she'd stopped freaking out long ago. Still, Garrett felt for the kid. He realized some of it was just the generation these parents were born in, but it had to be hard on a kid to be in pain and not be more important to his mother than an electronic device. "Okay, well, it looks pretty swollen, so let's see how bad it is."
He helped the boy remove his shirt, apologizing with every wince. It was a necessary evil, though, so he could examine the shoulder better. With gentle fingers, Garrett inspected the shoulder, trying to determine if a closed reduction would be enough or if Ryan would need surgery.
"Well, the good news is that it looks pretty minor. I'll need to manipulate it back into place, and you'll need to wear a sling for a few weeks. Ice and rest, understand?"
Ryan rolled his eyes, but he nodded.
"Yeah, I hear ya."
"Don't worry, Doctor. I'll make sure he follows your directions," the mother said, once again glancing up briefly from her phone. Somehow, Garrett doubted that she would be great at getting him to follow directions. So he turned his attention back to the teen.
"I know it's no fun, but if you don't listen to me, then it might get worse and need surgery. You want to heal faster, you let it rest. Now, I can't guarantee this won't be a little painful, so would you like a numbing shot?" "Nah, man, I'm good. Just get it back in." "You got it."
Garrett wondered if he'd been as stubborn and macho as Ryan was trying to be when he was younger. Probably. It was a pretty common teenage boy affliction, invincibility syndrome. In his day, they'd called it the Superman complex. But he had to give it to the kid. He didn't cry or scream when Garrett worked on the shoulder until it popped back into place.
"You're a tough guy, Ryan. Good job. I'll send the nurse in with the paperwork and you can be on your way."
"Finally," the woman said with a sigh. Garrett kept his opinions to himself until he was out of the room and out of earshot, but then he couldn't help mumbling about the situation. "Everything okay?" Renee asked as he handed her the chart.
"Yeah, just dealing with a mom in there who couldn't seem to be bothered to look up from her phone. Rubbed me wrong, I guess."
Renee flashed him a sympathetic smile. "I can understand that. Do you need any help with her? Want me to play bad cop?" Before he could think about it, a grin broke out on his face. He hadn't been expecting those words to come out of her mouth, nor could he picture her laying the law down for this woman.
"No, I think it's good, but thank you for the offer."
She shrugged and smiled mischievously at him. "Anytime. I know it doesn't seem like it, but I can be as scary as Yolanda when I want to be." Chuckling, Garrett grabbed his next chart and headed for that patient's room. He doubted that Renee could ever be as formidable as Yolanda, but he sure wouldn't mind watching her try. The rest of his shift flew by, and before he knew it, it was 7 o'clock. He filled out his last chart and then headed to the staff area to grab his personal items. "There you are. You ready?"
"Yep, all set."
Garrett slung his bag over his shoulder and followed her out of the staff lounge and to the elevators. Though he had expected to hear some hushed whispers as they walked out together, it seemed everyone was too busy to pay attention to them, which was quite all right with him.
"Do you mind if we take my truck so I can drive?"
he asked when they reached the parking lot.
"It helps me remember the layout."
"Of course," Renee said. "As long as you promise to bring me back here. I don't want to be stranded somewhere."
"I would never do that,"
Garrett said. taken aback until he looked at Renee and realized she was kidding.
Oh, ha ha, maybe you deserve to be left after that.
She smacked his arm playfully, and Garrett opened the passenger door for her. It was nice having someone to banter with after a long day, and it was extra nice that she understood the pressures he faced every day. As soon as she was situated, he climbed into the driver's seat.
Thank you for offering to show me around town. I'm sure my brother would have gotten to it eventually, but he's a cop, so he's a little busy. It's nice to have a guide who knows where everything is.
Renee smiled up at him as she clicked her seatbelt into the buckle. You bet. I remember when I first moved here and I was so lost. I had to learn everything on my own, and it took me quite a while.
Where did you move from?
Garrett fastened his own seatbelt and started the truck. Texas. Renee turned away from him and looked out the window. It was a long time ago, though. He glanced up at the laconic tone to her words. What had happened to her in Texas to make her move? His curiosity wanted him to ask, but he could tell from her stiff posture that she probably wouldn't divulge that information today. If you go right, she said, when he reached the parking lot exit, you'll hit the business district. There aren't a lot besides warehouses and commercial buildings, but it's worth knowing what's out here. Unfortunately, it's one of the shadier parts of town, so I wouldn't park your car here long, and I wouldn't come at night.
Are you saying Fire Beach isn't safe?
He knew every place came with both its good and bad, but Clay had said nothing about excessive crime here. He'd have to ask him later. Not unsafe exactly, but you know how it is. There are parts of every town that are safer than others. This just happens to be our more unsafe side of town. As he drove slowly through the commercial area, she pointed out various warehouses, a few banks, and large retail stores. Then she indicated for him to turn right again. If you follow this road, it leads to the beach, but we won't go that far.
Is it a nice beach?
Garrett asked, straining to see it from their current position. He was looking forward to going to the beach when the weather warmed up. Yeah, but the weather isn't always great, so it doesn't get as much use as beaches in California or Florida.
Or Texas,
he offered, hoping to at least find out where in the big state she'd lived. She glanced over at him as if she knew he was digging for information. I wouldn't know. I lived in the central part of Texas. No beaches where I lived. In fact, there was very little water at all, except for one lake that would notoriously flood the streets every time we had a large rainfall.
Well, that doesn't sound like fun.
A soft chuckle escaped her lips and she shook her head. It wasn't. Made driving through town tricky. I remember one time in high school it was so bad I could feel the water lapping against the bottom of my car. That was a little scary.
I bet.
The scenery outside the window began to change, and soon smaller businesses and restaurants lined the streets. Welcome to the main downtown, she said, as he slowed the truck to take all the stores in. There are, of course, other areas with stores and restaurants as the town keeps growing. But this was the main part of the town for years, and it still kept that charm.
This is amazing.
The streets had a small-town feel, even though the town of Fire Beach was quickly outgrowing that classification.
Do they decorate for the holidays and have festivals and things?
It was one thing he always wanted to see. Chicago decorated, but it was never that small-town feel, and he'd always wondered what it would be like. Renee smiled. Yeah, they really do it up at Christmas. There's an ornament scavenger hunt, an Advent challenge, and of course, pictures with Santa. In the summer, there are street fairs and kite festivals.
I hope I get to see some of those,
he said, as he flashed her a warm smile. And though he didn't say it, he wondered if he might get to attend those events with her. Oh man,
He should not be thinking about spending Christmas with her. He wasn't even dating her. Yet. But he could feel his resolve to not date her crumbling. She was so patient and kind and pretty. And yes, he'd said he wouldn't date a coworker again for a reason. But Carrie hadn't been a believer, and Renee was. Plus, he'd been praying about the situation the last few nights and hadn't received a no. Of course, he hadn't received a firm yes either, so he would continue to pray. If God wanted him to be with Renee, then he would make it clear. Garrett had no doubt. Suddenly, Renee gasped and he slammed on the brakes. His body flew forward and then back as the seatbelt kicked in and kept him in place. "What the?" "There's been an accident. Call 911. She pointed out the window briefly before racing out of the car. Garrett threw the truck in park before following suit, dialing the numbers on his phone as he jogged after her. 911, what's your emergency? "There's been an accident on..." He paused and looked around for a road sign. He didn't know the road names well enough yet. "Renee, what street is this?" "Coral Street," she hollered back as she neared the first vehicle. "Tell them the corner of Coral and Shelby." Garrett repeated the words into the phone for the operator and then detailed the scene to the best of his ability. "It looks like a near head-on collision. One car is upside down and I can see at least 2 occupants. Unsure if there are any in the back seat. The other car seems to have swerved into a light pole. I see a driver, but can't see other occupants yet. I'm a pediatric doctor at Fire Beach Hospital, and I have a nurse with me, but we're going to need at least 2 ambulances." "Understand. Alerting departments now. Please give me as much information on the occupants as you can." Garrett jogged toward the car at the light pole first. A woman was in the driver's seat, but her eyes were closed and a trickle of blood ran down her temple. "Ma'am, can you hear me?" He leaned in to feel for a pulse, sighing in relief when he found one. It was thready, but there. "Okay, 1 adult passenger in the vehicle by the light pole, woman, appears to be mid-30s. She has a clear head injury and is unconscious. Pulse is thready." He scanned the car and sucked in a breath. "I see a car seat. Checking on the baby now." He tugged on the back door. It resisted initially, but after a few tugs, he managed to get it open. Leaning across the seat, he pulled back the cover on the car seat. Inside was a baby who couldn't be more than 3 months old. Her eyes were closed and he felt desperately for a pulse. At his touch, the baby opened her eyes and began to cry. 3 to 4-month-old baby in the back. Appears responsive. Unsure of injuries, but the back doesn't seem to have sustained as much damage. "Thank you. Can you tell me about the other occupants?" "Yes, hold on." He touched the baby's head. "It's okay, little one. I'll be right back." Though he didn't want to leave the baby, he jogged over to Renee and the other vehicle to pass along the information. 2 teenagers, she said, shaking her head. "Neither are responsive." He relayed the information to the dispatcher and then inserted his earbuds so he could have both hands free. "There's a mother and baby in the other car. Mother is also unresponsive. Can these 2 be moved?" Renee shook her head. "I'd like to wait for a backboard. I don't know what condition they're in." Garrett took a moment to examine the car and sniff the air. When he was satisfied there was no gas leak or risk of explosion, he nodded. "Okay, I'm going to go back and check on the baby. Holler if you need anything before the ambulance arrives." Renee issued a single nod and squatted down again to continue monitoring the situation. Garrett jogged back to the other car and wrestled the car seat out of the back. The baby was still crying, but he was hoping to calm her down with movement. "My baby, is she okay?" Garrett turned to the mother in the front seat, who was now somewhat conscious and struggling to unbuckle herself. He reached his free hand in. "Shh, she's fine. I've got her right here, but I don't know the extent of your injuries, so please don't move until the ambulance gets here."
The woman was clearly suffering from shock as she shook her head and continued to fumble with the latch. "No, I have to get her."
"Hey, what's your name? My name is Dr. Young. I'm a pediatric doctor, and I promise I won't let anything happen to your baby."
The baby's cries began to quiet as he continued to swing the car seat softly. "Megan," the woman said. "My name is Megan. Do you promise to take care of her? She's all I have."
"I promise. Listen, she's quieting down already."
The baby's cries slowed as they turned into soft whimpers, and then the sound of the approaching siren filled the air.
"You hear that? That's the ambulance. We'll get you taken care of, and then you can be with your little girl at the hospital, okay? Can you tell me what happened?"
"The other car came out of nowhere. I was paying attention, but suddenly I saw them and there was no time to think. I swerved, hoping to avoid the collision, but I guess I didn't do that very well."
"Hey, you did great. The car wasn't so lucky, but I think you and your girl will be just fine."
The ambulances rolled to a stop and 2 EMTs hurried in his direction. Garrett rattled off what he knew and then stepped back to let them assess the situation. He looked down at the car seat and shook his head at the beautiful baby, who had somehow fallen back asleep even among the noise and flashing lights. Renee appeared at his side a moment later. "How is your car?"
"Mom suffered a head injury, but the baby seems okay. How about yours?"
She sighed and looked back to the car where the EMTs were working on pulling the occupants out. "Don't know. Smelled like liquor in the car, so they were probably drunk. Found a pulse on both, but they were weak. We'll have to see."
"I'd like to head back to the hospital with mine and check the baby myself. Do you think you could follow in my truck?"
Renee nodded and looked back toward his truck. There was no crowd yet, but she had no doubt one would be forming soon. "Yeah, I'll follow the ambulances. I'm sorry our tour got cut short." Garrett shook his head.
"It's not your fault, and we can finish it later. I'm glad we were here, though."
"Me too." Their gazes locked for a moment, and Garrett felt his heartbeat quicken. Renee was not only beautiful and fun, but she was a calm head in a crisis, something he considered a requirement, especially in his line of work. In fact, she was checking off every one of his boxes, and he couldn't help but feel that perhaps this was God showing him it could work with her. "We're loading up the woman," the EMT said, grabbing Garrett's attention. "You want to come with the baby?"
"Yes, please. I'd like to check her out more closely at the hospital."
"Let's go, then." Garrett glanced back at Renee, but she nodded and motioned for him to go.
"I'll see you there,"
he said, before climbing into the back of the ambulance. As the doors shut, Garrett looked back toward Renee. He didn't know why, but he wished she were with him now.